Dr. Baliga here. This podcast is on Kawasaki-like disease associated with COVID. Editorialists in the Lancet have provisionally called it Pediatric Inflammatory Multisystem Syndrome, temporarily associated with SARS-CoV-2. Goes with the acronym PIMS-TS. And this was formulated by experts in the UK and published by the Royal College of Pediatrics and Child Health. The interest today is because there was an article in the Lancet which was an observational cohort study from the epicenter in Italy, that is the city of Bergamo in the Bergamo province, which described a 30-fold association between the syndrome and COVID. What is Kawasaki disease? Traditional or typical Kawasaki disease is an acute and usually self-limiting vasculitis of medium caliber vessels which almost exclusively affects children. The 2017 criteria of the American Heart Association for Kawasaki-like presentations include both the classic type, that is fever for equal to or greater than 5 days, plus 4 or more clinical criteria, including bilateral bulbar non-exudative conjunctivitis, changes of lips or oral cavity, non-suppurative laterocervical lymphadenopathy, polymorphic rash, erythema of the palms and soles, firm induration of the hands or feet, or both, and incomplete types. In incomplete types, fever equal to or greater than 5 days, plus 2 or 3 of the aforementioned clinical criteria, and the values of ESR or C-reactive protein or both were taken as an additional diagnostic criterion in association with the presence of anemia, thrombocytosis after 7 days of fever, hypoalbuminemia, hypertransaminemia, leukocytosis, sterile pyuria, or an echocardiogram showing coronary aneurysms or cardiac dysfunction, that is depression in LV function, mitral valve regurgitation, or pericardial effusion. In this study, Kawasaki disease shock syndrome was defined as Kawasaki disease accompanied by systolic arterial hypotension, a decrease from basal systolic blood pressure of at least 20%, or appearance of signs of peripheral hypoperfusion, ejection fraction and concentrations of troponin I and pro-type BNP, that is pro-BNP, were measured and were used as indirect signs of myocarditis and heart failure. Using the Pediatric Rheumatology International Trials Organization criteria, they defined MAS, that is often in traditional Kawasaki disease, the patients may fulfill the criteria of macrophage activation syndrome MAS, resembling secondary hemophagocytic lymphohistiocytosis. The cause of Kawasaki disease remains unknown. However, earlier evidence suggests that an infectious agent triggers a cascade that causes the illness. Even though this was a small study, the alarm was that there was a 30-fold increase incidence of Kawasaki disease in this population. When compared to traditional Kawasaki disease, where the median age is 3 years, in the COVID-associated inflammatory syndrome, the mean age was 7.5 years. Children diagnosed after SARS-CoV-2 epidemic began showed evidence of immune response to the virus, were older, and had a higher rate of cardiac involvement and features of macrophage activation syndrome. The authors of this paper therefore postulated that SARS-CoV-2 virus may cause a severe form of Kawasaki-like disease. Despite the fact that Kawasaki disease was reported over 50 years ago by Tobisaku Kawasaki in Japan, who reported 50 cases. The cause of Kawasaki disease remains unknown. The most accepted hypothesis supports an aberrant response of the immune system to one or more unidentified pathogens in genetically predisposed patients. However, the search for infectious triggers have been disappointing. This study raises the question whether indeed this condition is being missed in children. In the US, only 1.7% of the cases have been younger than 18. In Netherlands, it's been 1% of the cases, and a large observational cohort in the UK has been 2%. Whether these proportions reflect lower susceptibility among children versus adults, or similar infection rates but much higher proportions with asymptomatic disease, is unclear. Studies from several countries have confirmed that severe illness and mortality due to COVID-19 among children are rare. However, accurate estimates are unavailable because of an absence of true population denominators. It is important to know the extent to which children are affected, because children can transmit COVID-19 at schools and to adults, and has implications when countries plan how to reopen communities. The patients in this cohort received steroids and they received IVIG. However, the urgency to understand the pathophysiology of this new phenomenon might improve our insights into our understanding of Kawasaki syndrome. Also, what needs to be defined is whether coronary artery aneurysms are long-term effects of this condition. I recommend the listener to read the original article and the accompanying editorial in The Lancet, 13 May 2020. The editorial is written by Dr. Russell M. Winner, who is the president of the Royal College of Pediatrics and Child Health in the UK, and Dr. Elizabeth Whitaker, who is the secretary of the British Pediatric Allergy, Immunity and Infection Group.